All right. Hello, everyone. This is the Mind Body Marathon podcast, and I'm your host, Dr. Alia Kormanik. And to my left is Samua Kormanik, my beautiful wife, and work at the office here and future health coach. And to my right is Alia Whitman, who is a medical doctor, and she's our current guest for the show. And today's topic, basically, we're just going to be talking a lot about, sort of doctor's talk. We're going to be sort of talking about bridging the gap between medicine and alternative medicine with like chiropractic and also different rehab services and things like that, but also some of the issues within the actual health industry to begin with. So basically, Alia over here, she is going to start at our practice as an independent contractor doing private medical and concierge medical work. And we're going to kind of talk a little bit about how that started and why that started that way. So yeah, if you want to just give me a little insight on the beginnings of that.
So I think I've been your patient for 8 or 10 years.
Yeah.
So a long time. You've known me for a long time. You've seen me through pregnancy, marathon running, all versions of life. And we have a lot in common. We have a lot of kids. We are believers, and we're both a second marriage. So we kind of have a lot of those things that we share in common. And so I probably have been talking to you about alternative medicine for a long time.
Mm-hmm.
I think it was Christmas this year that you were like, Alia, you just got to do this.
You just got to do it.
I was like, you're right. Just take the lead.
So what do you do currently though?
So currently I stepped down. I was a medical director for an emergency room at the Cleveland Clinic, and I loved that job. I love that job still, but my side passion has always been alternative health and wellness. And what does that really mean? And, a lot of what I do in the ER is sick care. And I really want to do healthcare.
Yeah.
So that's kind of where this all started. And if it wasn't for you and Samua, I would not be going down this path, but I definitely feel like it's where God's called me.
Yeah.
And it's amazing how since December, just next thing after next thing has kind of been in my step of the next person I needed to meet, the next thing, the next rep, here's what people paying it forward of, here's what you need.
Yeah.
And it's just all falling into place. It's really exciting.
So awesome.
Well, I think one of the interesting points that I want to pick apart there is that you mentioned sick care versus healthcare. What do you mean by that?
Yeah. So 90% of people that come into the emergency room come in because they're afraid that they're sick or that something's wrong, right? Fear drives a lot of emergency room care. But a lot of times people aren't sick in the sense that they have a labeled disease, right? They have dis-ease, meaning they don't feel well, but everything's normal, right? And so you go to the doctor, you go to the emergency room, and I have all these things. I don't feel good, or I have pain, or I have something has to be really wrong. And my role there in the emergency room is to say, you're not crazy. You're having symptoms. And I think a lot of times as doctors, we leave that out.
Yeah.
We leave out you're not crazy. This isn't a character flaw.
Right.
You're not lazy. You're not, a wimp.
That's true. Because
right?
On the back end, if you don't phrase that right, people get really mad and upset.
Right?
And this stupid doctor said this about, it's like they kind of take it that way.
And I think one of the biggest reflections after what I've been through postpartum and big surgeries and things is people really are suffering, even if it's not their traditional, like, this is your diagnosis, right? And so to look at people as human and to say, like, man, you really are suffering with this. The good news is you don't have to stay in the hospital. You don't need surgery. Yeah. And then from an ER perspective, I'm like, good luck, go follow up.
Well, I mean, an interesting point there is that the idea of a diagnosis.
Yeah.
And I think that there's a book out there called the Diagnosis Delusion, is that has that idea of being able to code and put down on a piece of paper, what does somebody have? That's a real issue because you use the word dis-ease. That's the vast majority of what people are feeling on a day-to-day basis. And so it's like, you might just generally have a headache, and it's like, there doesn't have to be a diagnosis. You just have a headache. And sometimes it's just because your system's a little off, but what's the diagnosis? Like, I don't know, like you need to drink more water or something. Like it could be that simple.
Right. It doesn't have to be cancer, right? It doesn't have to be a big aneurysm or a something. But that also doesn't mean you're faking it just because it's not that diagnosis or ICD-10 code that's billable to your insurance. And so that's the biggest part of, my leap out into this side of concierge and cash-based is I don't need to put a label on what you're going through to get your insurance to pay for it. I've already made all these negotiations, contracts, cash-based services of this is what we need to get to the bottom of it, or, where I can meet you where you're at, of this is how much you do or don't want to do. And this is what's important to you, or you're just really not going to sleep at night until you know that your organic acids are normal.
Yeah.
Sure. Here's the cost, like I can meet you there, because again, a lot of that is still angst and suffering, where when you're stuck in a traditional medical model, it's like, well, the standard of care and versus like what your insurance will pay for in terms of, well, you don't meet this criteria for me to bill your insurance for this. So you're going to be out of pocket, which is going to be a lot of money, versus looking at it on the cash pay side of negotiating outside of those systems.
Mm-hmm.
It makes it a lot easier to acquire tests and things that people are looking for, or that just want to be healthier, right? You're already pretty healthy, but you have some dis-ease, you have some dysfunction or something that's really keeping you from being your best self. And so it's like, that's what I'm really excited about, is meeting people where they're at to be their best self.
I think it's kind of perfect that you're coming from the ER background, because many years ago now, it'd be 13, 14 years ago, when I started down the path of like looking at alternative medicine, as it's kind of weirdly named right now. One of the presenters at this great conference that I was at, he kind of but he just was talking about how all medicine started as ER type medicine. It was just triage and ER, and everything else about medicine that we know today, or the different like everyday ailments, some minor diseases, things like that. It was all handled, by herbs and lifestyle and sunshine or whatever.
Right.
And so the whole concept of medicine that has originated was meant to be more like, you need stitches, you have a broken bone, like something major has happened. And we've definitely gotten away from that.
Yeah. And I think that comes down to people not really understanding the difference between like vitalism and allopathic, which is critical. Like the concept of healthcare with from the allopathic perspective is that you need something from the outside to help you. You need surgery or a foreign medication to help you. So that's allopathic. That's a very distinct set of healthcare.
Yeah.
And then vitalism and vital healthcare sort of is on the other end of the spectrum, where you're helping your own body manage the actual illness. So you're just sort of nudging it in the right direction, but in the end, you're using natural elements, like you said, like, sunshine and like, but also from my end of things with like adjustments and working on muscles. And I'm not putting anything into anybody's body. I'm just working on a muscle or working on a joint to get healing, and, maybe using some acupuncture needles and things like that. But it's like, in the end, it's vitally different from allopathic.
Well, I love the quote, that chiropractic is based on, that the power that made the body can heal the body.
Yeah.
And you just need to make sure that all the different pathways and every different substance or whatever the body needs, is there for it.
Yeah. And that's what really drove even the name of my practice, Physician Within, is I really want people to look within, right? To look at themselves as perfectly capable, perfectly able to heal. And that, you may need a few supplements, you may need medications for a little bit, but my goal isn't to have you on 500 supplements for the next 10, 20, 30 years or eons of your life. My goal is to bridge you into your health, into your body, into your function. And we may need something to get there, some lifestyle changes. You didn't end up where you are overnight, right? So even for me, I didn't end up in this shape I'm in overnight. This has been the last 10 years. And so it may take some supplements, it may take some medications to get things to where I want to be. And that's a bridge or a period of time. But the goal isn't like, oh, I'm going to start you on this and you're going to be on it forever, which somewhat, when you go to traditional medicine, that's where you kind of get to, is like, well, now you have high blood pressure. And that's a symptom. And I think that's a lot of current medicine is treating symptoms versus root cause. And that's a lot of what I want to look at is root cause of, so why do you have high blood pressure? I can put you on hypertensive medications, but if you're not fixing your finances, if you're not addressing your marriage, if you're not looking at your faith and taking in your whole person, those numbers are just going to keep going up, because I'm just putting a Band-Aid on a symptom versus like, let's look at the root cause. There's other biomarkers and other things that can help. look into those things from a different angle instead of just purely, here's the numbers, here's the trend, here's the medicine. Now you now have hypertension the rest of your life. And there are some people that do have that, but.
Well, and then obviously what ends up happening for most people is you put them on one medication and then that one creates some symptom and then they need a medication for that symptom. And it just keeps going, that domino effect.
Yeah. And you see so many people that are, suffering or trying to remember how to take all these things. And once you end up on more than one or two medications, I mean, even for me as a physician, I'm like, when was I supposed to take that? Or, oh man, I haven't taken that the last 2 days.
Yeah.
And that's a lot of also what I ran into, even looking for alternative medicine and looking for somebody to be the balance between what my traditional education was and what the alternatives are, is that, I'm a mom of 4 kids. I work in an ER. I work night shift. I work all these different things. I'm trying to fit in appointments with Leo or other people. And then somebody wants me to take 60 supplements. Well, I buy all the supplements. They're all still sitting there, of even just, okay, I buy them all. I load them all up in the, pill packs and do all the stuff. And then once that's out,
it takes 2 months to refill that pill pack.
Yeah.
I know.
So it's like, and it's one of those, and if you're managing that times 4 little people, the priorities fall in. So I think that's the other opportunity, is to really meet people where they're at. Like, where are you? What does your life look like? Can you even take supplements right now? Maybe you can't. So you said, like, what other ways? How can you start simple? And I think, you and I have connected on that a lot, of just get outside.
Yeah.
Yeah.
And then, focus on the basics and stuff. But a long time ago, I met this lady. She was she was a consultant for hospital directors. So she was former Mayo Clinic manager. And so she basically just kind of helped hospitals run more efficiently. And she said in passing, we were talking at USA Track Meet, and she said in passing that, if you look at a cardiologist, they're paid on retention. They want to have people come back consistently. If you look at an orthopedic surgeon, they don't want retention. They don't want to see you again. They want you to replace your knee and you're done.
Same for ER. I don't want you to come back.
Well,
for the same thing.
Right. And that's the goal, right? So like, it just depends on where you're at on the spectrum. So she would often say, like, they will often disagree with each other on how to manage cases. Like, for instance, the orthopedic might say certain things to help a person heal quicker that the cardiologist might disagree with. And she would often say, like, you just want to look in the middle.
Mm-hmm.
And I was like, that's such an interesting point of view, because you really do just need to look at the agenda, which is like, where are they at on the spectrum? Obviously if you are seeing a cardiologist, there's probably something pretty severe going on, but in the end, it should be the goal of everyone involved to not just sustain the symptoms, but to try to fix the cause of everything. And often that's not addressed.
And I think too, what's hard, or, we've talked about what's broken within the healthcare system. This has always been a side passion of mine, but, going about traditional medicine, I didn't wake up every day thinking about, like, how can I make the most money off this patient? How can I retain this patient? How can I do whatever? There's all those background factors of the healthcare system that are being pushed down on me. And then I'm being pushed back against by the patient, and I'm kind of stuck in the middle in the vice. And I think a lot of, physicians are kind of stuck in the vice, right? And they don't
And that's why a lot of them are unhappy.
Right.
Or they're doing what you're doing.
And, right. And they're looking for a different way.
Happening. They really generally, like, probably you got into the field because they want to help people. They want to help people have better lives, live longer, and not just live longer, but live longer and be able to actually enjoy their lives. And so they're finding that they're having to, like you mentioned with insurance companies. I mean, we deal with that with our clinic all the time. And it's ridiculous because the insurance company would rather wait and pay $30,000 for somebody to get a knee surgery instead of paying for 10 visits, to come and see us. That would be a fraction of that cost.
Exactly. And I think the other thing to realize is that when you go see a traditional physician, right, you go see them and you want a non-traditional approach, you got to find someone that has that background or has that bend. Because if you go to an apple stand looking for oranges and then you try to tell them why they should sell oranges, but they sell apples, it's a fight, right?
It's an act of futility.
Right. And so it's one of those, and it's not that, going to a cardiologist or going to an orthopedist or going to those are bad. It's more, you need to find people you trust. And if you don't trust them, and you go to them with the air of mistrust, it frustrates both the patient and the doctor. And so it's one of those things of, as you're looking for providers, as you're looking for, and which providers is one of my least favorite terms, but as you're looking for physicians, as you're looking for someone to care for you, take all those things into account, because that's what's going to give you the most engagement with that person, and them the most engagement and fulfillment with you. The people that I engage with and have the most fulfillment with in the ER are the patients that are kind of like-minded, or that I can just look at them and be like, do you need a hug? They're like, yeah, I need a hug.
Yeah.
Like, yeah.
That's awesome.
And it's one of those, or, to even look and say like, hey, what's your faith background? And some people are like, I have, no faith background, or I don't want anything to do with that. It's like, that's fine. Or they'll say, I'm a believer. I believe in Christ. I've been praying this whole time. It's like, hey, can I pray with you? That's a totally different engagement and interaction when you find your people. And it's not that you can't, have a provider that's not that, but it's more along the lines of know the expectation going in.
Yeah. I mean, there's a component of like, somebody can know their stuff. Like a doctor can be like, have this amazing resume and CV, and it just looks amazing. And so you go in and you see them and you're like, wow, their bedside manner is terrible. It's like, well, that really carries a lot of weight. And
a lot of weight.
Yeah, a lot of weight, because then the patient compliance will be substantially less. But the vast majority of people are frustrated by physicians because, like you said earlier, most physicians are sort of stuck in the middle, like between the demands of the patient and the demands of the hierarchy that they work under.
Right.
And then they're not happy. So that shows up with, they plow in the room and they're very disgruntled, and they just sort of like offer up this quick thing, and then they just leave the room. And then they're like, they didn't even touch my knee, or they didn't even work my, they didn't even like look at me.
Yeah.
And I hear that all the time. But the other big thing that I think is a real issue within our current healthcare system is, and this isn't even within medicine itself, it's even this way within rehab, is everything is so siloed.
Yes. Yeah.
And
you
that
have
to
to
me,
go to the specialist of the pinky finger, right?
It's
Like you
crazy.
can't just like see someone that just will look at you as a whole person and not like, yes, your pinky finger is important and whatever's going on with it. But what about your whole body? Like, what about the inflammatory state and all the other things from your neck down?
It could just be like that you're just massively inflamed, and that turns out to be like, something that would normally be a 2 out of 10 turns into a 5 out of 10, right? But even within me, within my side of the rehab, it's like I'm a chiropractor. So, but I treat, all the joints, I treat all the muscles, and I basically just manage, I'm generally like a muscle doctor. But I'll get everybody like, oh, do you work on knees too? Because they just think I work on backs.
Right.
It's like, I actually probably work more on knees than I do on backs.
Right.
It's funny because we'll have patients that sometimes I'll get phone calls where a patient's like, well, I came in like 3 years ago and I had this shoulder thing, and, Dr. Leo fixed me, and Dr. Mann, I have had to come in. It's like, but now my ankle's bugging me. Can I come in for that too? It's like, they're so used to things being so siloed that even if you have worked on something outside of their back, their expectation is still like, oh, he must just be the back and shoulder doctor. He can't possibly be the ankle doctor.
Yeah. Same. And I get the same thing, from the ER perspective of, oh, can you do this? Can you do that? Of those things. Or people expect I can do everything. And they're, kind of like Grey's Anatomy, where they're like, oh, or House, well, you're going to see me. Now you're going to do my endoscopy. I'm like, no, I'm not. I could.
I'm not a TV show.
Right. Yeah. Like I'm not an all-in-one service. There's a lot of things, I joke a lot that I'm, the jack of all, master of none. But there are certain things that we definitely are the master of from an emergency perspective. But I think that's also, like you said, the benefit of coming from an ER background into what I'm going into is that I very much am aware of the emergent things and or a lot of fears that people have of emergent things, and how to say like, no, that's not what's going on. Or, I really can't tell you that's not what's going on. You do need to go to the emergency room. And so that's one of the features I'm really looking forward to offering patients, is a keep me out of the ER service of, can you just talk me off a ledge, or do I really need to go?
Yeah.
Because there are people that you do really need to go.
So our style of practice is where we want to go into the proactive, healthy individual that people just want to sit, sort of like take health into their own hands. It's like that type of person, they are hedging their bets and they don't want to lose all of it, right? They don't want to get to the point where they have to have a hip replacement, or they have to have a heart, or they have a heart attack or something severe. So they're literally, investing time and energy when they're healthy or a little dis-ease, when there are warning signs, and then to prevent that big thing down the road.
I think part of the problem now, and unfortunately we have seen this now creep up in all aspects of the culture, is that everything has to be like a box or a camp, or, everybody has to pick their hill to die on. And as opposed to being like, there's a time and place for everything, regardless of whatever your beliefs are on different things, on all topics, there's always a time and place for something. And so a lot of people think that, well, if I'm going to go naturopathically, or if I'm going to see a chiropractor, then that must mean that I'm the type of person that just doesn't believe in medicine, whatever that means, because it's not like medicine is something that doesn't exist that you have to have faith in. As opposed to thinking of like what you just touched upon, like, let's hedge our bets. Let's, be natural as much as we can and make these smart decisions and look for these all body encompassing treatment options, and the concierge side of things, not the one size fits all, which currently is a lot of the stuff going on out there. But, if something happens that you need to go to the ER, or you need to go, get some medication to kind of, like you mentioned early on, like, let's put the fire out and then go out and see why did the fire start. And for whatever reason, people don't think that way.
Yeah.
They think it's like one or the other versus like, hey, let's do this along the way. And, if you break a bone, go to the ER, go see a doctor.
Yeah. Like I had this case today that was very similar to this situation where the individual was not doing good. They were in a lot of pain, and we had seen them a couple of times, and I advised them to get an image and start pursuing other measures to help with our treatment. We'll still continue treatment, but I think that we need to pursue these other measures. And they were like, I'm just not going to do that. I'm just going to continue treatment with you and it'll be fine.
Hope for the best. Yeah.
And I'm like,
like, you're amazing at what you do. And whenever patients call, I always kind of say this to them. I'm like, if it's not broken or a full tear, Dr. Leo can fix you. But if it's broken or a full tear, then you're going to need something else. Yeah. I mean, you're not a magician.
Yeah. And I think that's one of the things that's most exciting for me right now in this kind of phase of transition that I'm in is I get to learn from so many people. And I spent a week out in Arizona last week learning from a naturopath and learning from, they have a naturopath, an MD, and PT. They have medical fitness. So how they run their clinic, just in terms of how everybody's really collaborating versus staying in their silo and or, discrediting what the other person does to increase their own value. And nobody in that practice is giving like you have to vaccinate or you don't have to vaccinate your kids. They're more looking at, hey, this is what's important to you. This is what you need to know about vaccines. This is what you don't want to know. Here's all the in between. Now you go make a good decision for you. Yeah. I'm not here to vote. I'm here to be your advocate and give you all the information and let you really decide. And I think it was just so cool to be in that practice and see all the ways that they're really helping people. Even like you said, from myofascial pain to looking at things of how else can you get better? What is really driving your pain?
Yeah, if you went and you right now could walk into the treatment room at the Olympic Training Center or the treatment room at, your local professional football team, like, the Browns or the Steelers or whatever, and you walked into the treatment room, you would not really be able to tell who has what degree.
Correct.
And there's athletic trainers working alongside PTs, working alongside chiropractors. And then, the orthopedic will come around and it's like, and massage therapists are there. And it's like, everybody's just genuinely working together to get that athlete better. And that team approach is absolutely lost to the general public.
Yeah. And I think the other thing to think about, from my standpoint, your standpoint, I was a college athlete, you were a college athlete, you did a lot in marathon training and Olympics and all those things. I never made it to that level, but even now, like just training for life, right? That there are, even if you're not a multi-million-dollar athlete, you still deserve that care of having a multidisciplinary people care for you to really get the best outcome. And I think that's what the biggest people I'm excited with working with is, moms, dads, kids, anybody who just says like, I want to perform in my life, not just out there on Sunday afternoon,
I know, because it's like right now I'm dealing with my grandma in Brazil who is really, really taken down by Alzheimer's. And her body is great. Her body is strong. She physically can do things. And it just breaks my heart because she's had a decently difficult life, struggled through lots of different things and always worked and all these different challenges. And here she's finally old enough and has the resources that she's built up to be able to kind of enjoy her later years. And yet she's not able to.
Right.
And it just breaks my heart because it's like she spent all these years of her life, struggling and fighting and working hard to build all this up with the mindset of, when I retire. And now she's retired. And she used to talk about all this travel she wanted to do. And when I was there, like I couldn't get her to walk outside with me to the park 5 minutes down the road from her house. And so it's like like you just mentioned, like the marathon of life, making sure that it's not just about your performance. It's not just about your body, being able to perform at high levels, but the longevity of your body being able to perform so that you can just enjoy a walk to the park.
And well, that's hence the name of the podcast, Mind Body Marathon, right?
Right.
We were looking at it obviously through the lens of
that wasn't even intentional.
Right.
Yeah.
I know that. Yeah.
But I think people need to look at the difference between lifespan and health span.
Right.
Right. You can outlive your health span, and that gap between when your health span dies and when your lifespan continues to your last breath, though that gap is where people suffer. Right. That's where people are in nursing homes or all the things that you hear people say of, I never want to do that. Right. And so then you're like, okay, you never want to do that. Well, I'm not going to be able to make you live forever. Yeah. But what if I could expand your health span so that you can do what the Lord has for you up until your last breath?
Yeah, so there are a couple hunter-gatherer tribes around the world that still exist, and I know specifically with Dan Lieberman's work, the Hadza tribe. One of the things he would say about them, and this is just outside of Kenya and Africa, he would say that their health span was right all the way up to their lifespan, and if you followed the arc of their life, they're very active from when they're born to when they're in their 20s, and then they have kids. When they have kids, they're least active. And then once the kids are old enough, then they're actually most active. So the grandparents, that their roles from like the 40s to the 70s, they're actually some of the most active individuals in the hunter-gatherer camp. And that's such a foreign concept because now they don't have kids to rear. So what they're doing is they're going out and hunting and gathering and at a very high level. And then they live right up to like 70 and then they just die quick. Yeah. And it's like, but like they were actively committing to their camp and their community right up until that point.
Yeah. And I think that is another huge aspect that's missed in healthcare is what's your purpose? Mm-hmm. What are you doing? What does God have for you?
Yeah, what drives you?
What drives you? What's your why? We talk about that, in working in a hierarchy and working in these things, you have these big cultures and organizations, right? That high performing teams, high performing culture of business, all those things. But that's on the, micro or macroscopic level when you think about it. But you also need to bring that down to the microscopic level in terms of for you personally, that's also going to be what drives your wellness. And the idea of, I'm going to do till X day and then I'm going to retire and do nothing really isn't good for your health and isn't good for your mind or body.
Even if you go, I'm going to retire and play golf.
Right. Yeah.
Or I'm going to retire and play pickleball now.
Right. Yeah.
Which is cool. And you should definitely do that. Yeah. And I am jealous because I would love to be playing games all the time too.
Same.
However, that changes your purpose.
Yeah.
Absolutely.
And what else?
And you're not adding value.
Right.
So that's a big issue.
I think that too, like even just talking with my parents about, my parents are in their mid to late 70s and they're still working and still doing tons of things because they know when they watch their parents, once their parents stopped engaging in the community and or involved reading what's going on in the world and all that stuff, you lose your own sense of value or the way that you can give back. And I think, to your point of they're the busiest and they give the most back to the community once they've gotten through that child rearing age. And I think, when people used to say it takes a village and now they're like, yeah, where's the village? It's kind of true. Like, where is the village? But that was the village that people experienced in the past. And I think, as healthcare, as, a community, that we can sort of give back to patients and people and hopefully inspire that for the next generation so that our kids really do have that village.
I think that one of the best things that you will be bringing to the table is, that concierge idea, the concept of it's not cookie cutter, it's not one size fits all. And marrying in, like you mentioned, like what is valuable to you, what is important to you, having Naomi, who's a child with autism, And she developed autism, after the fact. She was not born that way and wasn't until about 18 months or so. And people ask me all the time, in my opinion on vaccines, do you get them? Do you not get them? And what do you do? And at the end of the day, it's like, wherever you fall on the camp of anything, there's going to be pros and cons. And I would tell people, like, either my opinion of stuff that I've learned, or direct them to, like, here's some resources that you should go, read up on. But I'm like, at the end of the day, like, you have to make the decision that you can live with, wherever the cards may fall, because you never know which way they're going to fall, whichever camp you decide to be on anything. And so having somebody like you that you can come in and discuss, like, here's what I'm feeling right now. Here's what's valuable to me. Here's my priorities. Here's where I want my life to go in 10 years. Here's what I hope to be doing. And like you mentioned, and here today, this is the viable amount of time that I have to dedicate to this. I cannot be making flowcharts of when I'm taking my medications or things like that. And combining all of that for that specific person. And how valuable that will be to your patients.
And I'm really looking forward to too being like, I'm not a good fit for you. I could take your money. You could pay me a lot of money, and I'm just not it. I'm not the one for you. I'm not your people. I don't see things the way you see it. And I think that's a huge part of finding somebody to care for you is, who is your person? Who do you fit with? Who understands you? And, like you said, to your point, can meet you in all those things.
Yeah. I mean, so we could continue this for a very long time, and we will definitely have some future episodes with regards to this concept and dissecting some of this stuff. So, anybody who's listening to this, please respond with some comments on some topics you want to hear from us, some pieces you want us to sort of flesh out with regards to any aspect of healthcare, whether it be injury rehab, to some of the metabolic stuff, to some hormones, just some of the trending topics right now, like Ozempic and all that sort of stuff. Like, definitely we want to flesh that out and let everybody know what our opinion on that is. But for now, I think we want to sort of close the episode with kind of a final quick sprint, right? So a last little topic that we can, or tidbit that we can, an actionable item that we can give people to help them out with their daily habits. So let's start with you, Alia. So do you have any quick ideas for people?
Quick ideas, or start simple. If you are not feeling well or you want to perform better, the two things you can focus on are sleep and how much water you drink. That if you want to do things differently, you have to do things differently. And so look at what you're doing, why you're doing it, and protect your sleep, drink enough water.
I love it. What about you?
So adding to what Alia said, I would say, one, just the belief that your body can and will take care of you in itself. And so just trust that the power is there already. And then adding to what you said, starting simple, just without overwhelming yourself, without thinking about all the different vitamins or things you could be doing, get outside for at least 15 minutes a day and do something. Even in Ohio weather, we can probably do that 90% of the time. And, look at eating fresh foods, just stuff that comes out of your fridge and not out of boxes, and make an appointment with Alia.
Sounds good.
Yeah. And so you sort of stole my thunder there. My idea was going to be, when you're eating,
I'm a good student.
Nice segue. When you're eating, make sure to eat things that aren't necessarily ingredients driven. So, is there an ingredients list in broccoli or an apple? So, focus on simple items, focus on natural, healthy foods. And if you can, buy organic. That's vitally important. We will have definitely a whole episode on that and talking about glyphosate and, its issue with glycine in the body and just kind of fleshing that out. We will definitely cover that topic. But again, I like what everybody's saying. So start with the basics, right? Good, healthy sleep, making sure you're good there, staying hydrated, and then paying attention to the basics with regards to sun and natural food.
And I think too, we get so caught up in the restriction of things.
Yeah.
Instead of, I think part of what we're used to in medicine is prescription. And so what I would add is I would prescribe for you to eat things that nourish your body, instead of looking at, I can't eat this or I shouldn't do that, to look at, this is going to make me feel great today. This is going to nourish me. This is what's good for me. Because then you get that positive joy, endorphins, all those things. So yeah, definitely add to all that.
I love that, having the prescription of that. My doctor said I need to do this.
Yeah.
It's genius, actually. All right, so that's it for this week, and be sure to subscribe to our page and give us some comments on what you liked, what you didn't like, what do you want to hear from us, and again, till next time, thank you.